Welcome to No More Excuses. Why is the fall season depressing? Many people find the change of season depressing. Factors such as a drop in serotonin levels, reduced sunlight, and a change in weather are all potential culprits. In addition, some people may be experiencing the seasonal affective disorder. Fortunately, there are ways to cope with the change in season. In today's video, we will look at why the fall season is depressing, and several ways to overcome seasonal depression. If you like this video, make sure to subscribe to the channel to see more encouraging content from No More Excuses. Now back to the show. Why is the fall season depressing? A drop in serotonin. While the drop in serotonin during the fall is not as extreme as the decline during the winter, some people experience a reduction in the neurotransmitter. Serotonin is a vital mood neurotransmitter the brain produces in response to light. Without enough light, serotonin levels drop. This drop affects the brain's functions and leads to depressive symptoms. The lack of sunlight leads to a drop in serotonin, the brain's primary neurotransmitter that helps regulate mood and energy levels. Low levels of serotonin are depressing for some people and are one of the causes of seasonal depression. However, you can do a few things to help your mood and avoid the symptoms of seasonal depression. Changing your environment and adding more natural light in your home can help you feel better. People who suffer from the seasonal affective disorder, SAD, usually feel depressed in the fall and winter months. This is because their bodies produce less serotonin during the fall season. The decrease in serotonin affects their sleep patterns and mood. Individuals who experience SAD are more likely to have bipolar disorder than those without it. Reduced levels of sunlight. The fall season can be depressing for some people due to reduced levels of sunlight. The reduced light in the sky can make the human body produce less serotonin, which is a chemical that regulates our sleep and wake cycle. The decreased sunlight can make some people feel more depressed, and as a result, they may experience symptoms of SAD. Researchers believe that reduced sunlight can cause people to develop the seasonal affective disorder, SAD. SAD affects people of all ages but is more common in women and younger adults. Researchers have also linked this condition to reduced levels of vitamin D, which may trigger symptoms of depression. The reduction in vitamin D may also disrupt the body's internal clock. Reduced levels of sunlight during the fall and winter seasons also affect a person's hormone levels. The reduced light in the fall and winter months affects serotonin levels, a neurotransmitter in the brain that contributes to happiness. The decreasing levels of serotonin will make someone feel more lethargic and depressed. Change in weather. For some people, the fall season can be a depressing time of year. A depressed person may seek out solitude during this time of year. The change of seasons can cause a polarized inner experience, making it difficult to deal with everyday life. People who suffer from the seasonal affective disorder may be more prone to the depressive symptoms associated with fall. This is because the days become shorter and the nights grow longer, lowering their energy levels. The shortened days may also remind them of the approaching winter, which can cause a low mood. Seasonal affective disorder. Some people who suffer from the seasonal affective disorder, SAD, experience depressed moods during the fall season. The symptoms of SAD typically worsen during the fall season and gradually ease up during the spring and early summer. If you're experiencing these symptoms, you should see a medical professional. Treatments for seasonal affective disorder include light therapy, psychotherapy, and antidepressant medications. However, some people do not respond to these treatments, and others experience adverse side effects. Cognitive behavioral therapy is an alternative treatment that can help those with SAD manage their symptoms and avoid depressive episodes. Getting more natural sunlight is one of the best ways to combat the symptoms of SAD. Another effective method is to exercise regularly. Exercising can boost serotonin levels in the brain, which can help with depression. It can also improve sleep quality and reduce anxiety. How to tell if you are depressed? If you like the video, please support the channel by subscribing. The support means a lot to us. Thanks. A quick test. There are several signs of depression, one of which is physical fatigue. It can be hard to get out of bed in the morning, and it can last for days. If you are experiencing these symptoms, you may be suffering from depression. It is crucial to find help right away because you don't have to suffer through it alone. Luckily, there are many ways to get help, and you can do it for free. If you suspect you might be suffering from depression, you can contact your primary care physician or a psychiatrist or psychotherapist to find out more about your specific symptoms. You can also take a short, clinically validated depression test. This test is called a PHQ-9 Patient Health Questionnaire and is designed to be given by a medical professional. It is essential to talk to your doctor if your symptoms worsen. Taking an antidepressant or other treatment could help you overcome your symptoms. In addition to medication, talk to loved ones about your feelings. Avoid alcohol and other drugs, which will make your symptoms worse. They can also interact negatively with antidepressants. College students and depression. Depression is a common condition, but not everyone is affected by it. It affects between 10% and 20% of people and is more likely to affect women. It occurs more frequently in northern areas than in southern ones. Certain risk factors can increase your chances of developing SAD, including bipolar disorder and underlying conditions like anxiety, panic, or eating disorders. Depression can be caused by various factors, including lack of sleep, unhealthy eating habits, and the stress of academics. While the effects of these factors vary among individuals, they are common among college students. Symptoms of depression can include a lack of interest in one's enjoyable activities, sadness, hopelessness, difficulty concentrating, trouble sleeping, and thoughts of death. Decreased exposure to the sun is another factor that may contribute to seasonal depression. The reduced amount of sunlight affects the brain's chemistry and can affect mood and behavior. People in northern areas may face sudden changes in daylight and darkness. Since our bodies operate on an internal clock known as the circadian rhythm, limited sunlight throws off this clock and disrupts the sleep-wake cycle. 4 proven ways to master seasonal depression. Seasonal depression can be extremely difficult to overcome, but you can find a few proven ways to combat it. These tips include boosting your serotonin levels and following healthy lifestyle habits. Also, getting outside in the sunlight can help elevate your mood and promote a more relaxed and happy attitude. Seasonal depression is caused by shorter daylight hours. The reduction of daylight disrupts the chemical balance of 2 brain chemicals, melatonin and serotonin, which regulate sleep and mood. Exercise. Increasing your exercise levels is an effective way to combat the symptoms of seasonal depression. Exercise helps the body release endorphins, boosting your mood throughout the day. In fact, researchers found that exercise can be as effective as psychiatric medication and cognitive behavioral therapy for seasonal depression. It can also help you build self-efficacy and self-esteem. You may find that getting outside and engaging in physical activity can improve social relationships. You may also be able to increase your self-esteem by achieving a small goal, like walking your dog. You may also find that exercising with a friend or family member can help you deal with your symptoms of seasonal depression. Aim for at least 10 minutes of physical activity each day. Even a short hike can help with symptoms of seasonal depression. You can also try yoga or indoor activities such as brisk cycling. Vitamin D deficiency. If you suffer from seasonal affective disorder, you may be unable to feel depressed during the winter months because your body has not yet been supplied with enough vitamin D. This can be a problem for sufferers. After all, they may not experience vitamin D deficiency symptoms until late autumn or early winter. This means that symptoms may not be noticed at first and may be accompanied by a lag phase. To prevent this, you should increase your vitamin D levels. Several studies have shown that vitamin D deficiency can lead to depression. One study conducted in the Netherlands compared vitamin D levels among retirees with and without depression. The vitamin D level of patients with depression was significantly lower than that of the general population. Light therapy. Light therapy is an effective way to treat seasonal depression. This depressive disorder is more common in the fall and winter. Light therapy simulates natural sunlight and can improve seasonal depression in 50% of cases. The light therapy devices can vary in brightness and are sold online and in most drugstores. Before beginning light therapy, however, it is essential to consult a doctor to determine the right amount of light you need. Talk therapy. There are various types of psychotherapy, including family therapy, individual therapy, and group therapy. Individual therapy is designed to focus on an individual's needs, while group therapy brings together people who are suffering from the same condition. Together, these individuals can learn to better cope with similar situations. Therapy can last from a few weeks to a few months, depending on the severity of the symptoms. Typically, the treatment takes 10 to 15 sessions to see noticeable results. While seasonal changes affect our moods, other factors can contribute to these mood swings. For example, increased social pressure and workload may contribute to these mood swings. If you're experiencing a low mood, it's vital to seek professional help. Seeing a licensed healthcare professional can help you overcome seasonal depression. A healthcare professional can help you detect the onset of seasonal depression. The doctor can prescribe antidepressants to help alleviate symptoms. If you have a history of depression, you must see a therapist to properly understand the cause of your seasonal depression and prevent recurrences. Summary. While many people enjoy the crisp fall air and look forward to the first snowfall in their area, this season is depressing. The cold weather and the sight of bare trees and ice on green grass can make anyone feel down. In these cases, it is vital to seek help from a mental health professional. Utilize these tips to help you overcome seasonal affective disorder. If you are still feeling depressed, please seek medical attention.